Good afternoon, everyone. Thank you for joining us for our regularly scheduled pre-arranged COVID update. So, as usual, I'll pass things over to Dr. Fitzgerald for an update.
Thank you, Minister. Good afternoon, everyone, and thank you for joining us today. I'll start with an update on COVID. So, since the last media advisory, we have 10 new cases of COVID in our province. In the Central Health region, there are 3 cases, all related to travel. In Eastern Health, there are 2 cases, both under investigation. There is 1 case in Western Health who was a contact of a previous case. And this person is also a previous presumptive positive case. And there are 4 cases in Labrador-Grenville Health that are all contacts of a case. There are also 2 new presumptive positive cases in Labrador-Grenville Health. And the total number of cases in our province is now 1,551. There has been 1 new recovery, leaving 49 active cases in the province, and 1 person is hospitalized due to COVID-19. A total of 283,985 tests have been completed to date. As an update to the cluster in the Roddickton region, we have identified now 19 confirmed cases, and that investigation remains ongoing. This area will therefore remain in level 3, and we will reassess this next week. We also have cases in the eastern region that are linked to social gatherings. As the gatherings were largely indoors without masks and large, this makes the level of exposure higher risk. There are also a large number of contacts stemming from these exposures, and this puts a strain on the public health's contact tracing resources. As a reminder, vaccinations change how we manage contacts of cases, and testing and isolation now takes the vaccination status of the contact into consideration, as well as their symptom status. Anyone who is identified as a close contact of a case will be contacted by public health and given instructions specific to their circumstances. Once again, I want to send a huge thank you to all the public health staff who are investigating these cases. These are not easy calls to make, and if you are contacted by public health, please be kind, respectful, and have patience as they carry out this important work. And while I understand that it is concerning to see emerging clusters and cases, it is expected with the 4th wave still underway outside the province. Atlantic Canada as a whole is starting to see the impacts of the 4th wave, with 327 new cases reported across the region in the last week. In response, Nova Scotia has delayed moving to the next phase of reopening, and New Brunswick and PEI have put in additional public health measures. We are closely monitoring what is happening in our Atlantic region and remain in regular contact with our counterparts in New Brunswick, Nova Scotia, and PEI. If we feel that changes to travel requirements are warranted based on the level of risk, we will take action as needed. We are seeing breakthrough cases in those fully immunized, but the vaccines are still highly effective in doing what they are intended to do, and that is preventing severe illness from COVID-19, causing hospitalization or death. And while breakthrough cases do occur, being fully vaccinated still reduces the likelihood of getting and transmitting the virus. Provincially, our case numbers make it difficult to draw meaningful percentages and conclusions. However, nationally and internationally, this evidence is very clear. The evidence is very clear on this point. Since vaccination started in Canada, among cases where we know the vaccination status, which is almost 700,000 cases, only 1.5% are in fully vaccinated individuals. This is a signal to all that we need to get our fully vaccinated number higher. We had anticipated reaching 80% of our eligible population fully vaccinated by the end of August. And while we are very close to this, and this is an incredible accomplishment on behalf of all of our vaccinators and vaccination teams, we've yet to meet that mark. So we're at about 78% right now. The vaccine is available, staff are available, appointments and walk-in clinics are available. So please make the time and get the shot for yourself, for your family, and your province. The National Advisory Committee on Immunization, also known as NACI, has provided guidance on 3rd doses for immunocompromised individuals. Evidence shows that some individuals who are moderately to severely immunocompromised, including those receiving certain medications that may suppress the immune system may have a lower immune response to COVID-19 vaccines compared to the general population. Based on this, NACI recommends that individuals who are moderately to severely immunocompromised should receive 3 doses of an authorized mRNA vaccine if they have not yet been immunized, or an additional dose of an authorized mRNA vaccine if they have previously received a 1 or 2 dose primary series, including those who received a mixed vaccine schedule. Newfoundland and Labrador will follow these guidelines, and more details will be available on our website tomorrow. If you are unsure if you meet the criteria for immune compromise, please discuss it with your healthcare provider. We want to make sure every dose given to every Newfoundlander and Labradorian is counted in our vaccine database, and we are asking any resident of the province who received 1 or more doses of the vaccine in a different province or country to visit the COVID-19 government webpage to submit their out-of-province vaccination record. It is anticipated that these out-of-province vaccination numbers will be included in the total provincial vaccination numbers in the coming weeks. In our provincial reopening plan, we indicated that we may be able to move to step 3 as early as today, provided we met our vaccination targets and the epidemiology was favourable. As neither of these conditions have been met, we will not be moving to step 3 at this time. We will continue to monitor the vaccine uptake and epidemiology, and we will move to step 3 when we are confident that it is safe to do so. We will get there, even if it is a little later than we had hoped, but we can do it only with your help. So please make the choice to be vaccinated. Even if you are fully vaccinated, it is still important to practice the same precautions that you have been for the last 18 months. So wear your mask in indoor public places, physically distance from those who are not your close contacts when possible, and wash your hands well and often. As we head into fall and we move into cold and flu season, children are back in school, more people are heading back into the office, and public health restrictions on gatherings have eased. We will inevitably see more respiratory viruses circulating. So again, even if you are fully vaccinated, if you feel unwell, stay home and book a COVID-19 test. Even if the results are negative, you should stay home to prevent spreading a virus to others. There are other viruses circulating, such as rhinovirus, which cause common cold, but it's really impossible to distinguish between COVID and a cold without having the test. So as a recap for anyone just joining us, we have 10 new confirmed cases of COVID-19 in the province today, and the total number of cases is now at 1,551. Please do your part to help keep our community healthy and help the province shore up its defenses against the 4th wave of COVID-19. Please get vaccinated and hold fast, Newfoundland and Labrador. Minister?
Thank you very much, Dr. Fitzgerald. Some months ago, we started talking about life with COVID rather than going for 0 cases, expecting, as we have seen, that we will see cases from time to time. That has certainly been the case. I would like to echo Dr. Fitzgerald's comments, acknowledging the really hard work of public health and their contact tracing. In view of the large numbers of contact tracing, I would once again repeat that you can ease their work significantly and make all of us safer by using the COVID Alert app. It is downloadable from Google Android, Google Play, or from the Apple Store. It stores no information on your phone. It requires a key to unlock and is safe and private. It is unfortunate that because of reasons I don't fully understand, people have chosen not to adopt the use of this. It would make our contact tracers' life, public health nurses' life, so much easier. We are doing well by comparison with anybody's standards with vaccination rates. I cannot recall an adult vaccination campaign in this province that has gone anywhere near as high as the current set of figures. But our rates are starting to slow. And I think it's important to repeat Dr. Fitzgerald's message that if you haven't had a shot, get one. And if you've had your first, go back for the second. It is the single most important thing you can do for yourself, for your family, and for the province as a whole. Because by having a high vaccination rate, we can have more freedom to move around without concern of disadvantaging those vulnerable members of our society. It is the single most important public health measure that you can actively take other than simply following the mask or distance recommendations that are in place at the moment. With the introduction in the near future of a vaccine passport, high vaccination rates and that passport will allow us to continue in a way we could not before, for example, during last winter and last year. Again, just to repeat Dr. Fitzgerald's comments, we want to recognize those people who have had their vaccines delivered outside Newfoundland and Labrador. There is a portal under the vaccination section of the COVID website. We would simply require a valid MCP card and whatever documentation Alberta or Ontario gave you able to be uploaded. The process of validating those credentials will take about 2 weeks, and then two things will happen. One, your numbers will be added to our first and second dose numbers, and secondly, we, through the provincial system, will be able to provide you with the appropriate QR credentials to allow you to use the vaccine passport when it goes live next month. So in closing, I'd wish you all would consider following, not only following the public health guidelines, but actually getting the shot if you haven't. It is so important that we get those numbers as high as possible. So with that, I think I'll pause there and turn it over to Leslie to moderate the media. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. At the previous briefing, it was mentioned about the vaccination passports that are coming. Wondering if there's a timeline as to when the guidelines on this will be coming out. Many people wondering what it means for their workplaces and if they will have to be vaccinated to work there.
We have not mandated vaccines for anybody. What the vaccine passport will be is an option for individuals and businesses to choose to use it if they wish. It should go live, we believe, around the first week of October. There may, depending on epidemiology and circumstances of case counts, where public health recommend we go to a lockdown in a certain area. I think under those circumstances, there may be conditions where using the vaccine passport could be mandatory under an SMO, but it might allow some businesses who would otherwise have closed under previous lockdowns to stay open. Those criteria will be worked out and will be available by the time the vaccine passport and the vaccine verification apps are available for use.
Thank you. And since the announcement that the vaccine passports will be coming into play, do we have an indication on if or how much vaccine administrations have increased? I know in other provinces they're seeing it increase to 3-fold in comparison to the trend they were on.
Our data shows that some areas have picked up, but I don't think we've seen the significant percentage increases that other jurisdictions have. Having said that, we started from a different place than pretty well any other jurisdiction. We went into this announcement with vaccine rates for second doses in the high 60%. Other jurisdictions were down at 40% when they announced it. So the room at the top, the leeway to actually hit our targets is a lot smaller. We haven't seen a big spike. We're obviously keeping an eye on it. And in actual fact, as I've said, in some areas our vaccine rates seem to have slowed up a little bit. We're not getting the same percentage gains day over day that we used to. I would encourage people to continue working on it. They've done a great job, but there's still room where we can do a bit better.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Thank you. Dr. Fitzgerald, I'm wondering the next level, level 3, You mentioned we haven't reached either of the targets. We're going to likely hit that 80% vaccination rate within a couple of weeks. In terms of the case numbers that you need to see, what do we need to see there in order to have you feel that it's safe to be able to open things up further?
We certainly would want to see that we have sustained low case counts, that we're not seeing any outbreaks anywhere, that we don't have areas of the province who are in a heightened alert level for whatever reason. We'd want to have a closer look at sort of areas of the province that may have lower vaccination rates to make sure that we're doing what we need to do to get those rates higher as well. So it's very difficult to give you a definitive number because things change as time goes on. But and certainly the other thing we need to see, of course, because the next step would be people coming in from elsewhere in the country or elsewhere in the world who are not vaccinated, just having a test upon arrival. So it would also be reflective of what's happening elsewhere and what we're seeing elsewhere in the country.
So considering we're seeing some provinces now with numbers that are even surpassing what they saw in previous waves, is there a world under which you would allow unvaccinated people from those provinces to enter Newfoundland and Labrador, even with more than 80% of the population still vaccinated?
So I think we need to think about that. So what we have is 80% of our eligible population vaccinated. So we still have a lot of children who are not able to be vaccinated and likely won't be able to be vaccinated until the new year. And that's about 56, a little over 56,000 people. So we do have to consider that. And so these are all questions that we have to take into consideration when we're making these decisions. So we're certainly watching what's happening elsewhere in the country very closely. Sorry.
We will now go to the phone. Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hi, good afternoon. Yesterday, among the things that the Nova Scotia officials announced was that, as you just announced, that private employees of any kind are not being mandated to take vaccines. How will a vaccine passport work in a venue if the staff there are not necessarily vaccinated?
Again, that's a decision for a private business to come to. We are still looking at the public health implications of having, for example, healthcare providers providing services who aren't vaccinated. Our numbers currently would appear to be pretty small there. So the answer about how it would work in private businesses, obviously there will be some guidelines, some recommendations for the initial rollout of the vaccine passport. But I think those could change and its use could change under circumstances where communities went into lockdown. So those will be hopefully a little bit clearer as well nearer the rollout day. But that's a work in progress at the moment, Peter.
Okay. I wanted to ask you, Dr. Fitzgerald, about the breakthrough cases and the percentages. You say that we can't make conclusions here, and one of the things here is that there seems to be a much higher percentage than just 1.5%. Do you have an explanation for that?
So when you're in a situation where the majority of either your travelers that are coming in, or if you're in a situation where the majority of the people in, say, who are exposed to a case are vaccinated, then you're going to see more vaccinated cases. So, and so what we know right now is that the vaccine, its effectiveness against, or vaccine effectiveness after 2 doses, up to a few weeks out, certainly can drop down a little bit. So there is a certain percentage of people who have had the vaccine who will be able to get infected, right? So that's not unexpected. What we're looking about with the 1.5%, that's looking at all the cases that have been vaccinated since the vaccination program started. And of course, initially there were far more unvaccinated people than there were vaccinated people. So over time that's going to balance out, and I don't think we've actually seen the true number of that as yet. But you know, when most of our travelers, for example, are coming in are vaccinated, then we're going to see more travelers who are vaccinated who are cases. Does that make sense? I kind of feel like I went around in circles there a bit, but it has to do with it just has to do with the actual numbers of vaccinated people that we actually have here versus other places. And then if we look at the people who are going to be most at risk for being positive, it's going to be those travelers who are coming in, and the majority of those are vaccinated as well. So that's part of the reason why we're seeing those numbers as they are.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Good afternoon. Earlier this week, it was announced that a case of COVID-19 was connected to Laval High School in Placentia. I'm just wondering if we can get an update on that situation.
So my understanding of that situation is that, you know, the investigation has happened, that public health has notified anyone who's considered a close contact that they've been tested. So far, we haven't seen any secondary cases from that, but that's not to say they won't happen. You know, it takes time sometimes. So we're still following it through, and but at the moment, it appears to be under control.
And what has uptake been like in the Roddickton area for the vaccine clinics that were being offered in the wake of the cluster?
So they did see some uptake in the Roddickton area. I believe for first doses, they went from 54% of the population having received first doses to 60%. So, you know, that's certainly positive. And second dose is not quite as much of an increase, but so they did see some uptake. I don't have the exact numbers in front of me, though, Richard. Sorry.
Thank you.
I will now go back to each reporter to see if you have one final question. Kellyanne Roberts with NTV. Do you have a final question?
Yes, thanks, Leslie. Just wondering about in Western Health that there has been talk that there were no vaccines for first doses for patients in that region available, and they weren't expecting any vaccine this week.
I'm not aware that there are any hold-ups with vaccine delivery. I know that over the course of the week, traditionally or customarily, we've seen lower vaccine rates on Sundays and Mondays in the Western and Central region because they have a slightly different schedule, as it were, there. I've not been told that there are no clinic appointments, nor have I been told there's no vaccine. My understanding is that vaccine supply is not an issue.
Peter Cowan with CBC. Do you have a final question?
I do. It's one for the minister about vaccine passports. At the last briefing, the talk was that the Quebec model was essentially what was being adopted. There, you have to be vaccinated in order to go into a restaurant. You're now saying the province isn't going to mandate that. It'll just be up for each individual restaurant to decide that. So I'm curious why it's not being mandated if we're introducing a vaccine passport system like Quebec has.
It may be a matter of semantics. My understanding was that the Quebec app was being used, and the Quebec software that is in the process of being adapted to Newfoundland and Labrador's IT infrastructure. In terms of the use of the vaccine passport, that will be the only software package that would be recognized and allowed in the province. That was the second piece. The third piece was its use after availability. So say for the sake of argument, it's available October the 8th. On October the 9th, any business who wished to use it could use it. And there may then be circumstances later, depending on case counts and vaccination rates in the community and other epidemiological factors that Dr. Fitzgerald's referenced, where a lockdown might occur in that community. But use of the vaccine passport under those circumstances would allow some businesses or some activities that would otherwise have been closed under previous SMOs to proceed. Those circumstances would obviously be clarified in an SMO, and there will be guidance prior to the rollout of the passport anyway to operators, businesses who chose to adopt its use.
Peter Jackson with the Telegram, do you have a final question?
Yes. I'm not sure, Dr. Fitzgerald, if you answered this in my last question, but we see a regular trickle now of travel-related cases. Are most of these people unvaccinated? And if not, what does that say?
So I don't have a breakdown of travel-related cases and vaccination status, so I wouldn't be fair for me to say that, but to answer that specifically. I will say that we have seen travel-related cases where people have been fully vaccinated and test positive. And some of those we find out that may have been older infections, or and some of them have been infections that they've acquired recently. So, but we know that, if vaccine effectiveness for symptomatic infection is, hovering somewhere between 70 and 80%, then we do expect that there are going to be 20% of people who may test positive after a vaccine. So I don't know that we can really draw any further conclusion than that there is an expected number of people who will test positive after they have the vaccine.
Okay, thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, thank you. Of the clusters that are being investigated in the province right now, Dr. Fitzgerald, would you say that these clusters are contained at this point in time?
Yes, I think certainly, I think public health in those regions have gotten a good handle on what's happening. Source detection, unfortunately, we haven't been able to find a source in most of them, and that's, I guess, to some degree not unexpected. But for the most part, I think public health has gotten a handle on who the contacts are, and they certainly reduce the spread. And we have seen some secondary transmission to very close contacts, but we've managed to reduce the spread beyond those very close contacts. And really, that's what we're really looking to do when we're doing this contact tracing, right? So, so I think for the most part, yeah, these are contained, but we will, we'll see how things go over the next week or so, especially with the Roddickton area.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thank you, Leslie. Just briefly, get the shot. It is the single most important thing that you can do for your family, for yourself, and for all of us collectively. And stay safe. Thank you for joining us this afternoon.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.